Hi everyone, I'm Dr. Muniz. This is Jacob, one of our therapists here. So what we're going to talk about today is a sciatic nerve syndrome, okay? Many reasons that it can be caused, to let you know. And the best thing to do is to be evaluated by a doctor to determine what exactly is causing it. But I'm going to give you the top 3 that I see here in my office. Number 1 would be a disc bulge. The disc is a structure, it's a cushion that is between each vertebra of the spine, and it acts as a cushion. Well, what sometimes can happen is too much compression can occur and then the disc will bulge out. When it bulges out, it's gonna go up against the sciatic nerve and put pressure on it. If that happens, the patient won't have pain running down their leg. Now, this condition is not easy to manage on your own. And the best thing to do is to have a chiropractor traction the disc and then adjust it. So do not try to manage that one on your own. Go see a doctor. Now, the second 2 common ones are muscular. Okay, this means that the muscles are putting pressure on the nerve. Now, sometimes that can just be due to lack of stretching. Other times it can be due to a muscle that got injured and then it contracted and then put pressure on the nerve. And the 3 most common would be the hip muscle, the hip rotator, the leg flexor, the hamstring, and the calf. All these areas can be pinched, pinching pressure on the sciatic nerve, causing radiating pain. Let me show you these stretches that can help it, okay? It can also help prevent it too. So what you want to do here is go ahead and lift your pelvis up like this and put a pad under the back. Okay, make sure that it curves really nice. And when it curves, you just wobble your knees like this. And what that's going to do is it's going to stretch the vertebra over that pad, and it may loosen it up enough to take pressure off the sciatic nerve. The second side is the hip rotator. That's another area where the nerve can get pinched. So you just do a stretch that stretches the hip rotator and the side of the leg. Okay, you hold it for about a minute. The third stretch would be to lift here, and then turn it in, and then go up and down with the foot. And that will relieve tension in the calf and the hamstring. Okay, let the leg down carefully, lift the pelvis. All right, so those are just some of the stretches you can do, and really only the top 3 causes of the sciatic nerve. I would recommend you maybe call me if it's a problem that you can't seem to manage or these stretches don't help. Definitely don't do these if they cause pain, because you could just make the whole thing worse, okay? But any questions, feel free to call me, and we'll be more than glad to help you with it. Have a great day.